All right, welcome to the Medical Association Facebook Live. My name is Aruna Arora. I'm the current president, and I am here today, super excited on this topic. We are here today with our Assistant State Health Officer, Dr. Karen Landers, who is also a pediatrician, and then Dr. David Kimberlin, who is our pediatric infectious disease expert in our state. We are very fortunate. He is the Children's of Alabama Division Director for Infectious Disease in the pediatric world, and he's a Red Book editor a few years, I believe, for the AAP. He has actually been involved directly with the ACIP as the AAP liaison, and literally took copious minutes at that meeting last week, November 2nd and 3rd. So we literally are here with the experts to discuss the pediatric vaccine for the 5 to 11-year-olds. Dr. Landers, if you want to start with an update for our state.
Yes, Dr. Arora, thank you so much. And we certainly, in the Alabama Department of Public Health, appreciate the partnership that we have with the Medical Association of the state of Alabama, as well as our partnership with Children's Alabama and all the contributions that Dr. Kimberlin and his ID team and other physicians have made to our response in this pandemic. We really want to spend a lot of time talking about the 5 to 11-year-old age group as far as vaccines, but I just want to give you a little bit of a snapshot of what's going on in the state of Alabama right now. If we look at our dashboard, we see that we actually still have several hundred cases of COVID-19 every day. And again, if you look specifically at some of our tabs on the dashboard, actually tab 6 is a very helpful tab to look at, and tab 8, but you can also see that children in the 0 to 17 age group are still making up about 18% of our cases. And the 5 to 11 age group is still making up about 8% of our cases. So again, this is contributing to our overall morbidity in our state. Now, we certainly know that persons are very fatigued with this pandemic, but we have to keep in mind that this virus is still circulating, Delta is still circulating, and if we look at what's going on statewide, our state is in the moderate range for community transmission overall. And we have to look at how is that really derived. Well, we look at the numbers of cases per 100,000, and right now we're seeing about 40 cases of COVID-19 per 100,000 population. And we are actually seeing our nucleic acid amplification test positivity below 5%, which is good. But again, when we look at those particular parameters, the numbers of cases per 100,000 and the percent positivity, the category assigned for the county is actually related to the higher of the two. So if we remain moderate in our numbers of cases, then again, the category will be moderate, even though our percent positivity is going down. Now, in talking about pediatrics, again, I've mentioned the numbers of cases that we have. We also want to be reminded that in addition to those numbers of cases, we only have had vaccine availability for 5 to 11 for essentially a week. I mean, we got most of our vaccine starting to come into Alabama to our pediatric practices, our independent pharmacies, our family pharmacies, et cetera, community clinics, as well as our children's hospitals that have been participating and our other hospitals that have been participating in 5 to 11 vaccine. We only started getting that vaccine the first part of the week. Some of the larger chain pharmacies that order from the Federal Retail Partnership were able to get their vaccine over the weekend. So we don't have data in our 5 to 11 age group yet. We are making some improvements on our dashboard, and we do expect to get that data up shortly, certainly by next week. What I can say about the 12 to 17 age group is we have about 38% of kids in the 12 to 17 age group that have received at least one dose of vaccine. And of course, keep in mind, we're talking about the Pfizer vaccine in this particular age group, as we will be talking about with the 5 to 11. And again, our stating the name of the product does not imply endorsement by the Alabama Department of Public Health, but rather those are the products that are available in this group. Now, I mentioned the vaccines coming into the state. We've all been a little frustrated, and I'll raise my hand to say I am one of the two most frustrated people in the state health department, and certainly one of my other colleagues is extremely frustrated that we haven't gotten as much vaccine as we'd like to have, but we did have 28,000 doses come in as of Tuesday morning, and we are getting more vaccine every day. Again, we pre-ordered just like everybody else, just like every other state. We put our orders in very early, but we don't have control over the shipping process here. So again, we do have a number of doses already in the state of Alabama. Federal retail partnerships have it, although as a pediatrician, I really appreciate the contribution there, but I certainly would like for kids to be vaccinated in their medical home if they can, or at the county health department, because we give a lot of vaccine too. We can order at least 140,000 doses of the vaccine at this point in time. So I don't anticipate that we're going to have a problem having enough vaccine to vaccinate kids. And I just really want to encourage parents to talk to your pediatric provider, talk to your healthcare provider about this, and really take advantage of this vaccine for the health and well-being of your child, and also to be able to keep your child from becoming ill and keep your child in school. And again, as a pediatrician, I think those are very, very important factors for me. So Dr. Arora, that's really what's going on in the state, and I'll turn it over to you.
Oh, thank you. That's a great update. Dr. Kimberlin, you want to take it away?
Happy to. This is a really exciting time. I mean, you know, we now have opened up a significant remaining portion of our population who are now, as of last week, eligible to receive the COVID vaccine, the 5 through 11-year-olds. And that is a remarkably just flat out wonderful position to be in. Now, I will say this, it's kind of stating the obvious. A vaccine doesn't do much good in the freezer or in the refrigerator. It needs to be injected into somebody's arm to be able to really have effect and have an impact not only for that person's health, but also for the community that they're living in, and the older adults that they're coming in contact with. So we need to get, now that we have availability, and as Dr. Landers said, increasing availability, as we move into these next weeks, we need to get people vaccinated. And I would just like to say very briefly that every major organization that's focused on pediatric and child health has said, get this vaccine. The American Academy of Pediatrics strongly endorsing vaccine of 5 through 11-year-olds, as well as 12 through 17-year-olds. The Infectious Disease Society of America strongly endorsing vaccination of pediatric and adolescent patients. The Pediatric Infectious Diseases Society strongly endorsing vaccination of pediatric and adolescent patients. This is something across the board that's recommended, and I hope anyway that that's enough for parents. You know, not only probably were they wanting and eagerly awaiting the vaccine rollout that they experienced this past spring, and then for the adolescents over the course of the summer, now we have that available for 5 through 11-year-olds. Hopefully that will be enough. In reality, there'll be a lot of folks that do have some questions, questions that are really quite easily answered. Maybe some we might even talk about here over the next 45 minutes or so. But if you have questions, go to your pediatrician, go to your family practice doctor, go to your community health center, places where you already are taking your child, people you trust for the health of your child, and ask those questions. And I think what you'll find is a strong endorsement of these life-saving vaccines. So I'll stop with that, and happy to field more specific things going forward. I'm excited and I'm relieved with where we are right now.
I know both of you have grown children that are no longer in this age group, but if you had children within this age group, and just like you treat all your patients as if they are your children, it sounds like both of you are highly endorsing no hesitation and no wait and see. You know, many people have concerns that the number of children in this trial were under, you know, a certain number that they would feel confident to have the confidence. Can you describe maybe some of the reasoning behind why we have that sample size and some of the signals that give high confidence, especially with your background?
Yeah, I'd be happy to. And Dr. Arora, I'd say if my children were 5 through 11, I wouldn't be on this Facebook Live call. I'd be at the doctor's office getting them vaccinated right now, literally. But you raise a good point. Let's talk about how vaccines are studied, and to do it, we've got to back up a year ago. In mid 2020. More than a year ago now. In mid 2020, Pfizer and Moderna and Johnson & Johnson and other vaccine companies as well, but pretty much Pfizer and Moderna really led the pack, J&J not far behind. They started very large studies. Pfizer was 16 and over, Moderna and J&J were 18 and over. And those studies enrolled tens of thousands of adults, or for the Pfizer vaccine also included older adolescents. So with Pfizer, we're going to stick with that because that's, as Dr. Landers said, it's not an endorsement of that particular product over any other. It's just that's the one we have available to us through authorization or approval from Food and Drug Administration for use in the pediatric or adolescent age range. So that's what we're going to be talking about. They enrolled about 45,000 people, 16 and over, in this study, where half of them got the vaccine, half got a placebo. And we had to do it that way then because we didn't know if the vaccines would work. So you had to give the vaccine to some, give placebo to others. And by the time that blind was broken in early December 2020, so about 11 months ago, what we found was that the vaccines were not only a home run, they were even more than a grand slam. I mean, this thing was knocked out of the city that the ballpark was in. No one had, in their highest, wildest dreams, hoped that it would be 94, 95% effective in preventing COVID disease, and yet that's what we found. So that moved us into the rollouts we all had last spring, with adults and the older teenagers. Then for the older the adolescents 12 through 15, and now the 5 through 11-year-olds, we don't have to do that giant study any longer because we already know the vaccine works. What we have to do is study enough adolescents, now children 5 through 11, to be able to say how strong an immune response does the vaccine provide in that population, and does that amount of an immune response correspond with the amount of immune response in 16 through 25-year-olds. That's the comparator group, which was a subset of the 45,000 I was talking about, is a pretty substantial subset. In order to look at those immune responses and have what is called immunobridging. If it gives as strong an immune response in a 5 through 11-year-old as it does a 16 through 25-year-old, and we already know that it prevents 95% or 90% of disease in a 16 to 25-year-old, then it's reasonable to infer that it's going to do the same in a 5 through 11-year-old. And that's a standard way that we have done vaccine studies and drug studies for decades. This is nothing new. We do a definitive trial, and then we do immunobridging studies. And in fact, that's what we have. And so that's why we know that it works. And there were like 2,300, 2,250, something like that in the 5 through 11 study of Pfizer children, 5 through 11, that were in that study. And so not only do we have a great idea in thousands of children how immunogenic it is, how strong an immune response it is, therefore how protective it is, but we also have a great idea of what the safety is. And it's actually even better tolerated in the younger child than it is in the adolescent and the adult. So the data, the results are another grand slam. I mean, it's a fantastic position for us to be in right now.
Yeah, so that's a great explanation, by the way. Some of the side effects, I guess, that we've seen with the adults and even the over 12, like you said, in this category, I mean, just from talking to many pediatrician mothers and colleagues who have had their children, they've had their appointments with their doctor's offices, but they were really wanting to rush out and get this vaccine. And so many did go to some of the some of the places that you mentioned, Dr. Landers, and are hoping to catch up with their peds offices for the second dose. And they have described barely any reactions essentially with this first dose, which it sounds like the trial data did show. Maybe, hardly anybody had a fever with their first dose. And it looks like it was a very few who did have a fever, and that was with their second dose in the trial, right? Yep. So it sounds really pretty decently tolerated at this point. I guess, there are a lot of people who are out there who their children have had COVID and they are feeling, a little bit confused on whether they should vaccinate their child. They think there's that natural protection along with the fact that this is a child. And so the risk is lower for serious, MIS-C or long COVID or hospitalizations. Do either of you have some sort of ability to kind of, make that topic a little less confusing?
Well, Dr. Arora, I know Dr. Kimberlin has extensive clinical experience at Children's Hospital regarding these patients that have been admitted. And of course, I speak regularly also with Dr. Estrada at the University of South Alabama regarding the patients coming in there. And one thing I would say before asking Dr. Kimberlin to follow up on this is that from our data and from looking at the information that we have nationwide and then really drilling that down to the state of Alabama, we need to remember that we do not know how any individual child is going to respond to a COVID-19 infection. And at least from our data, and again, I look at data every day, we've had otherwise healthy children hospitalized in Alabama, and at one point actually had over 55 children in the hospital in the state of Alabama with COVID-19, and our peak was 9 children on ventilators. And again, this is not something that we want to wish on any individual person. So I think that is concerning in and of itself. And then when we look at our MIS-C data, keeping in mind that we've had at least 121 kids and there will be more. Again, we have to verify the cases and look at the hospital records and go through some additional information to ensure that this meets the case definition. But we're going to have more kids in Alabama that were MIS-C. They've already had MIS-C. We just don't have them officially reported yet. So when you look at this particular disease, again, this is very severe, very, very concerning with these kids and the level of support that they require. And then the recovery time for these children. And these may be children that, in fact, I think it's really interesting, and I want Dr. Kimberlin to explain more, but these kids may not even appeared to have had COVID. In other words, the parents didn't really know they had COVID because they were asymptomatic. They were exposed to COVID, really didn't know. And then, all of a sudden they start having these symptoms of multiple organ systems being involved. And University of South Alabama actually developed a flyer on this because they had some children present, and I know Dr. Kimberlin's had similar experiences, kids that have come in that parents may have waited a few days thinking, oh, well, they just have a little stomach virus here. And the kid kept becoming worse and worse and more dehydrated and severe abdominal pain and, other symptomatology to develop. So, my practical information on this is not a disease that we want to just take our chances with. And certainly our information on natural immunity does not indicate that natural immunity is very good for a very long period of time. So, again, those are my practical points on it. I would love to hear what Dr. Kimberlin says. Thank you.
Well,
Thanks,
Dr. Landers, you summarized it well. I would start out by, I do recognize in the question that the raw numbers of children who have died, more than 600 nationally, that's a much smaller number than the 750,000 total deaths that we have had. That's a good thing, I guess, right? Except for the 600 families who've lost a child. They're left with that worst hollow out feeling you can ever even contemplate. I also want to point out, though, that raw number comparisons really are not fair because children don't die generally, whereas old people do. So if you think, open up the obituary page, you don't see pediatric, you don't see child age people on the obituary page before the pandemic. Children just don't die often, and adults do. So comparing raw number to raw number is not really a legitimate comparison in my view. Instead, I think you have to look in terms of top X number of deaths. And if you look in 2020 and 2021, the eighth leading cause of death for children was COVID. eighth leading cause of death for children was COVID. And that's not even counting the MISC or the long COVID patients that, may or may not even have had symptomatic infection and yet have long-standing, ongoing kinds of problems. And there's some information or some data sets that would suggest that somewhere in the 8% to 10% of survivors, people who don't die of COVID, which is most children, overwhelming majority of children, that 8% to 10% might have those long COVID kinds of problems that may go away pretty soon, but they may not. We just don't know. So if you have an opportunity to prevent that, I would think that any parent would want to prevent those possibilities, those risks. If your child has had COVID, as Dr. Landers alluded to, I won't call it natural immunity. That implies that it's okay. It's not okay. It is infection-induced immunity or disease-induced immunity on one hand versus vaccine-induced immunity on the other. You get to the same place, but you get there faster with the vaccine and it lasts longer. The immunity following infection or disease is less deep, less broad, and less long-lasting. It's inferior. It is inferior to the immunity following vaccination. Vaccine-induced immunity is superior. It lasts longer. It is more broad, and it hits more of the emerging variants out there. Delta probably isn't the last one we're going to see. It's the better way to go. So if your child has had, or if you yourself have had COVID and you're more than 10 days out, in other words, not acutely sick with COVID right now, please go get the vaccine, because that's the way that you can best protect yourself, get that insurance that you're not going to get infected again and get sick again.
I think y'all both said it really well. And the point is, this virus will stay here and we're all going to see it. So the question is, how do we want to face it? And the vaccine is really the way. You both have made such a great case for that. It's safe, it's effective, especially for this particular age group. I guess any other comments about schools in our state? I know several schools have been going mask optional. Dr. Landers, with the number, the percent positivity that you had mentioned, do you have some concern, seeing some of these unvaccinated, unmasked children in school settings?
Again, Dr. Arora, if we look at our data, and we're data driven, I mean, we use this information to make the best informed decisions that we can, the best recommendations that we can. I do think the first statement we have to acknowledge is that masks work, and that there is a lot of pediatric data on the use of masks. I have specifically quoted the information out of Duke University, Dr. Zimmerman and Benjamin, who did some wonderful studies last year and some wonderful work in the state of North Carolina. And again, that's not dissimilar to the state of Alabama. So masks do work. My concern in schools is that, again, when we have kids together in a congregate setting, and certainly we want to have kids in school, but we need to think of mitigation in terms of layers. And I don't have anyone complaining. I think Dr. Harris and I've had this conversation many times about hand washing and distancing, but I have people complaining about masks. And this is a layered strategy, and it really needs to be taken together. That being said, at the moment, our recommendation mirrors what CDC has said about the in-school kids, and that is K through 12. Obviously, we're recommending universal masking at this point in time because we do know that the virus is still circulating. And just to keep in mind that when you are moderate, again, that's a lot of cases. And even when you're low, that doesn't mean there are no cases out there. That just means that you have fewer tests positive. So I am very concerned, given the contribution that kids are continuing to make to this pandemic in terms of the percentages. I'm very concerned that we really need to keep those masks on kids for a while until we can see better data about what's going on and be able to make those kinds of decisions in concert with what CDC advises us. And then just finally, having the opportunity for kids 12 to 17, we've had that for a little while now, and then 5 to 11, let's give an opportunity for these kids to get vaccinated so we can further drive down those numbers. Just to follow up on what Dr. Kimberlin said, we just don't want to take chances with kids. And that is the concern that I have about this. So again, mask work, we need to keep them on until we have better information regarding, what's going on with this pandemic, and until we have more kids vaccinated. Thank you.
Yeah, I think that's really helpful. And it's important to remember when full immunity is reached, it's after that second dose and 2 weeks following that second dose. So I think you said it really well. It's all the different layers, the Swiss cheese model. So Dr. Kimberlin, I know on our last talk, we talked a lot about myocarditis. Myocarditis with COVID versus myocarditis in the 12 and over versus myocarditis in the under, in the 5 to 11. Can you discuss that topic?
Yeah, happy to. Myocarditis is an inflammation of the heart muscle or the lining around the heart. That's called pericarditis. And I want to point out that this was picked up very quickly after the Pfizer vaccine initially and Moderna too for the younger adults, after they were first introduced. And I think that is an incredibly reassuring finding, because it means that our safety systems that are eyes on the ground, that are watching and monitoring every single moment of every single day for problems with the vaccine, that they work, those systems work. These are I promise you folks, these are the most studied vaccines in the history of mankind. We know more about the COVID mRNA vaccines and J&J's vaccine, which is a different kind of platform. We know more about these than we do about any of the other vaccines, and we know a ton about all the other vaccines. So this is something where we not only have phenomenal insights right now, but also we have the mechanisms to find incredibly rare, and that's what the myocarditis events are following vaccination, incredibly rare events. I mean, we're talking on the order of like getting struck by lightning, or maybe even half as likely, twice as likely to get struck by lightning. That's the kind of comparator. So you get a sense of what the likelihood is of having that myocarditis if you have it vaccine associated. Now, in contrast, COVID associated, disease associated myocarditis is much more likely. And as Dr. Landers said, this virus is out there in the world. It's out there in our communities. We will come in contact with it, even though we're in a better place now. We should celebrate that. This is a pretty good period right now. In fact, I'd say it's a very good period right now, but it's still out there. And so how's the best way to prevent myocarditis? It's to get the COVID vaccine. Because if you get COVID, you're much more likely to have myocarditis, and the clinical consequences of the virus-induced, disease-induced myocarditis are much more severe than the really quite mild symptoms for those rare, very rare post-vaccine myocarditis cases. I'm talking about the myocarditis cases. I'm talking about after a vaccine, they're in the hospital for a couple of days and they're treated with ibuprofen, Advil. I mean, I'd rather it not happen at all. It's very rare and it's mild and very manageable. COVID disease-induced myocarditis, you're playing Russian roulette. You're rolling the dice. So the best way to prevent it is to get vaccinated.
Well, I think, with the background that both of you come from, I hope people are listening, because I know there are providers in our state who feel that the risks of this are potentially outweighing the benefits, but y'all are the experts. Dr. Kimberlin, I mean, you've been top leadership in the Pediatric Infectious Disease Society. Honestly, I don't think we could have more expertise here. Public health, pediatrics, Dr. Landers. Honestly, I really hope people are listening to this, because I can understand from a parent standpoint, and if you don't have a science background and you're listening to your friends and you're listening to, whatever is being said on social media, it touches your emotions, and you want to do the best for your child. And you certainly, I think what I heard one parent describe this angst. They said they don't want to give their child a problem. You know, it would be easier if their child had passively had some issue, as opposed to them actually giving them a problem. And that just struck me, because I was like, are there parents who really feel this way? You know, I mean,
Well, if I could,
vaccines are safe, right?
yeah, if I could interrupt, Benjamin Franklin, around the time that our country was founded, his 4-year-old son died of smallpox. And there's a wonderful quote, and it uses language, not the kind of vernacular that we use today, but in essence, what he said was, I chose not to vaccinate my son against smallpox because exactly of the kind of sentiment that you just conveyed through your prior conversation with a colleague or a friend. And yet he was standing at the graveside of his child. And so he said, what I hope is that other people learn from what I elected to do. Not getting vaccinated is doing something, and it's putting your child at risk. And if your child gets sick and gets better, but gives it to her grandfather or great grandfather and he dies, you're putting your great grandfather at risk, or your grandfather at risk if you're the parent in that example. So there, any choice we make is a choice. And it is actively deciding not to give the best protection if you don't get the vaccine. And I would suggest that's not something you want to live with if, God forbid, something bad happens, as it has for 250,000 Americans. 250,000. 8 fleeting cause of death in children. Not 250,000 there, that's 600. But I mean, this is the real deal, folks. And the beautiful thing about where we are now is we can prevent it. This is a vaccine preventable disease. But to get that protection, you got to get the vaccine.
Yeah, I think you said it really well. And this vaccine is so effective. It's not slightly effective. I mean, we're talking about over 90% effective. So it certainly is something. I mean, if somebody could tell us there was a way to prevent car accidents and children, fatalities, we would go do it. We would rush out and do it. We do what we can as parents. We get car seats, we update car seats, we wear seatbelts, and this is just human behavior, what we do to protect. And vaccines, from both of your backgrounds in the pediatric world and the pediatric infectious disease world, I mean, both of you couldn't be more passionate about how they are safe and effective, and how these have been tried in the most, wide ways throughout the world so far. So any last comments that either of you want to share?
Dr. Arora, I think Dr. Kimberlin, again, summed this up so clearly, and helping people to really, look at, if you're not vaccinating your child, you're making a choice, just as much as you are vaccinating your child, you're making a choice. But at the same time, looking at the risk there. And, as a pediatrician myself, and as a mother, again, Dr. Kimberlin is a father, he has children, regardless of the fact that our children are older, we set the bar high for our children too. And we set the bar high even when they were younger. And, I'm old enough to have seen some vaccine preventable diseases that have, largely disappeared in my career. I had an ER doctor a few years ago to call me and say, Karen, you're still old enough to have seen a case of measles, aren't you? And I wasn't sure how to answer that, but I said, well, yes, I actually have. So, what you got? But I think that looking back on my own experience as a mother, I recall Haemophilus influenza type B invasive disease when I was in residency, and how devastating that disease was to a number of children. And of course, when the vaccine came along, obviously there have been improvements in that vaccine, even when the first vaccine came along. And, I still very, very clearly remember my child at right about 2 years of age, coming down the hall at the health department. My children got vaccinated at the health department because, we obviously keep it in the family, even though their pediatricians were very, very involved in their care. But I had just this really significant sense of relief seeing my child get a Hib vaccine. And again, that, there's been improvement in the Hib vaccine since then, and other vaccines. Again, when you think about even vaccines that have implications later on in life, such as the hepatitis B vaccine. My kids were very early on the list getting their hepatitis B vaccine, and chicken pox. It was, right at the time chicken pox vaccine was coming out. Well, my kids had, had already had their little bout of chicken pox, prior to that time. I mean, just many other diseases. So, I set the bar high for my own children. And, even now, my kids are in their early 30s, and I've said they've given me the permission to share their vaccine experience. My older daughter, who's a physician, said her main side effect from the COVID vaccine, and now the booster to the COVID vaccine, because again, she is a physician, her main side effect is gratitude, because in her line of work, she saw people early on. When COVID started out, COVID was happening very, very early. People become very ill, people die. And, people die even, right in her own emergency room. So I don't think the fact that our children are older, or that my children are older, lessens my concern about their health and well-being. So, I encourage parents, if you have questions, please ask those questions of your pediatrician. Dr. Stubblefield, my new colleague, and I, again, we're both pediatricians, and, we stand ready to answer those questions as well. We just want to protect the children of Alabama. I say in a video that I have on the webpage with the Alabama Department of Public Health from a few years ago, I want to treat your children in the same manner that I would want my own children to be treated. Thank you.
The only other thing I would add, that was beautifully stated, Dr. Landers, and I do as well remember measles, and I remember Hib, and I remember, and the devastation that causes and are caused before we had the safe and effective vaccine. And so I think that is, and you've heard this, the parents that are listening, y'all have heard us talk over these last 40 minutes or so about how the vaccine prevents the very severe and rare. I mean, it is rare relative to the number of children infected to get put in the hospital, and certainly, thankfully, even rarer to die, but it happens. I think, though, that in addition to that, I'm not negating anything we've just talked about, but I want to layer something on top of it. If your child is 5 through 11 and is fully immunized and comes in contact with the virus in school, he or she doesn't have to quarantine. They don't have to go get sent home for 10 days. That means you don't have to take off work for 10 days. Or let's say that you have 2 or 3 children and one gets it and comes in and the others aren't vaccinated. That one has to wait 10 days. And then your next child who's already quarantining has to quarantine for another 10 days after the last exposure, which means you're out of work for 20 days, which is 3 weeks. This is the way we get back to normal. We get back to normal by vaccinating. And I know we're trying hard to get back to normal now. And I think, you walk around some communities and it looks pretty normal, but we all have this anxiety hanging over us that at any moment in time, it could just change, because that's what we've been living for 22 months. We don't have to do that anymore. We can take these safe and effective vaccines now available for 5 years of age and older, and we can be vaccinated and we can take control of our lives again. And I realize there are a lot of folks out there that are really mad about masking and mad about other things. And I wonder why they're mad. I'm not a psychologist, but I got to think that it's because they've lost control of their lives. I get that. Take it back. The best way to take it back is to get vaccinated. We have the power, let's do it. And it will get us not only the individual safety that we've been talking about through most of this event here today and this evening, but it actually will get us as a society back to where we want to be. And then I think with that, the anger dissipates and we get back to the Christian values that are the foundation for Alabama, for the Southeast, and for the entire country. And that's caring for your neighbor, loving one another, and being kind to each other. We all want that, and we need to be there. And the way to do it is to get vaccinated.
I think you said it really well. I'm thinking I missed my calling. My life motto is be kind and be curious. And I think pediatricians do that really well. I am the daughter of a pediatrician, so I think that's rubbed off on me. But be
Well,
kind.
We're all patients of pediatricians or former patients of pediatricians. So we got a common theme here.
Yeah, that's true. So, but I think, be curious, believe in science. We are at this point where we have these miracles with such an effectiveness. I mean, it's really just something that we should not take for granted. And Dr. Landers, like your daughter described, gratitude for that opportunity. And be kind. We want to continue to move forward, but we do need to be kind to each other by protecting everybody. So I really appreciate both of you, your expertise. I think many parents who hopefully are tuning in and who have been confused about what to do for their precious child, I hope they've taken away some feelings and helped kind of alleviate their burden in decision making, because it's hard being a parent. Thank you both. Much appreciated.
Thank you for the opportunity.
Absolutely.
Thank you, Dr. Arora.
Absolutely.